So at any point you've got any questions or anything, feel free to holler out. Put that in there because I kind of talk with my hands sometimes. So we'll just kind of jump right into it. So first aid is what you do before a trained person gets there, before the paramedics get there, before a doctor or nurse, or before the person actually gets to the hospital. And you guys have a really amazing opportunity to save someone's life by recognizing that there's a problem and providing some help. The most important thing that we can do to help someone is call 911. That is the most important thing that we can do, because we need to get that ambulance. We need to get those paramedics coming to us so that that person can get to the hospital where they have more care. Especially in our rural situations, it's really important because we've got a time lag. Like where I live, I'm 45 minutes from the closest ambulance. So I need to realize and recognize there's a problem as soon as I can, and then make that phone call to 911. Now the best way to call 911 is always going to be from a landline phone. I don't know what the exact address is here. If we had a landline, I picked it up. That address is going to go right to the dispatcher. They'll know right where I am. Now, if you don't have that, you can use your cell phone and call 911. But no, you're going to have to maybe explain where you're at. Depending on where your phone number is out of, my phone number is out of Globe. So chances are if I call 911 right now, I'm going to get the Healy County Sheriff's Office. We're in Pinal County. They're going to have to transfer me somewhere. So it can just take a little bit of time. But make sure that you call 911 right away. And then the other thing that we can do is we want to talk to these folks. When we're injured, we're scared, we're upset, we're kind of worried. So just talking to them can kind of calm them down a little bit. Hi, my name's Julie. I know first aid. Can I help you? Most people are going to be like, yes, please come and help me. From time to time, you may have someone go, no, leave me alone. I'm fine. Go away. Sometimes we're embarrassed when we're hurt. We don't want people around us. We don't want them to see what's going on. If someone tells you, no, leave me alone, then walk away. Leave them alone. Don't ever put yourself in a position where you feel that you could get harmed or something could happen to you. You can still call 911 and say, hey, this person's injured, but they really didn't want me to do anything for them, and then they can take care of that on their end. Make sure that you look, head to toe, see if you can see what's going on. If the person is under the age of 18, they cannot legally refuse help. But however, you still may have that young person that's like, no, leave me alone. If that's the case, leave them alone, see if there's a parent or a guardian around somewhere, or call 911 and see if you can kind of observe from a distance till help gets there for that person. If the person's unconscious, that's always a yes, please help me. Now we do want to look at the person, especially if they're unconscious, to see if we can give the dispatcher some clues. To see if there's anything visually that really stands out why they might be unconscious or hurt. We also want to look for medical jewelry, which is usually going to be a bracelet. This can give us some insight, but it can also be a safety thing for us. So most of the time it's going to say something like allergic to penicillin or diabetic, something along those lines. Really might not mean much. But if this person looks like they're having an allergic reaction, so we're going to talk about this in a minute, but their lips are swollen, their face is swollen, and you look at their wrist thing and it says allergy to nuts, and you're like, oh wow, I'm allergic to nuts too. You are not going to give this person mouth to mouth, because then you could end up in that same situation with the allergy. So it could be a safety thing. And on safety, you also want to stop and take a look at the whole area. Take a look at what's going on to make sure that it's safe for you to approach this person. If the person just fell off a roof, is there something up there that could fall down on you? Could the ladder fall on you? If it's a dog bite, where's the dog? If they're outside and they're being stung by bees and you're allergic to bees, you're not going to run out there. You're going to call 911 from inside where you're safe. If it's an auto accident, even if it's in a parking lot, stop and look and make sure that there's no cars that can come and hit you, because it's not going to do you any good to get hurt in the process of trying to help this person. And then something that folks always wonder about and worry about is, can I catch something from touching this person? And of course we know that the answer to that is yes. That's one thing that COVID taught us, is that there's communicable diseases out there. All body fluids, blood, saliva, vomit, urine, all those good things. And I know you guys are eating. I'm going to talk about some gross stuff. I apologize for that. That can all carry things like the common cold, the flu, COVID, HIV, hepatitis, a whole slew of things. So anytime you're working on someone, you want to try and get your first aid kit out, put those rubber gloves on, and be safe to touch that person. If you have, put a mask on. I'm kind of lucky because I've got my glasses on that always kind of takes care of my eyes. But if you don't have rubber gloves with you, I don't carry them in my pocket every day, and as long as you don't have any open wounds on your hand, you can touch someone, and you're not going to contaminate yourself. It's not going to go through your skin. You just want to make sure that you don't contaminate your face, things like that. Because of my glasses, I'm always pushing my glasses up and things, so don't touch your face once you've touched something, even if you have rubber gloves on. And then just make sure that you wash your hands when you're done really well and dry them. So the next, I want to start off with talking about some medical conditions. The first one is a breathing problem. If you notice someone breathing, there's a problem. We don't normally pay attention to people breathing. They do, it's kind of quiet. We don't see them breathing. We don't go like, oh wow, hey, check out that guy's breathing. He's got such good form. I wish I could breathe like that. It's not a conversation you ever had, I hope. If you're somehow, you can hear them breathing. It's too loud, it's raspy, it sounds wet, it's too fast, it's too slow. If it looks weird on their chest, normally we use our diaphragm and it doesn't look like we've got a lot of movement, but sometimes folks will be using these extra muscles up here and it just won't look natural. So if you're like paying attention to someone breathing, go up and ask them, hey, are you having a breathing problem? Are you okay? Most folks that have asthma, bronchitis will have an inhaler. Yes, please get me my inhaler. They take that inhaler. They're probably fine. Probably don't need to call 911. If they're having a breathing problem, they don't have that inhaler, we want to call 911 and we want to hang out with them until help arrives, because breathing problems can turn into cardiac problems, which can turn into a need for CPR. Another breathing issue that can come up is choking. So choking is when you have a foreign object, usually food, but it can be anything that's lodged in your throat and you can't breathe. So usually they say that the universal sign for choking is both hands up like this. Well, people aren't just going to stand there and wait for you to see them. They're going to be trying to cough violently. They may be bent forward. They may be pounding on their chest. We need to go up and talk to this person, not just come up and grab them from behind to do the Heimlich maneuver, which I'm going to show you in a minute. We have to ask them a question, which you may think is kind of silly, but we want to say, are you okay? Are you choking? You're thinking, well, yeah, duh, I'm choking. Help me. But we need to know if they can talk to us, if they can say anything at all. If they can say, oh, I'm choking, help me. They're actually passing enough air that they're okay. They don't feel okay. They're panicking. But at that point, just encourage them to cough. But if you get this, and their eyes are kind of bulging out, all right, we need to help them then. So you're going to get behind them. You're going to try and put your foot in between their legs, so in case they go unconscious, you can kind of catch them and help them to the floor. Then you're going to take both of your hands and put them together, and you're going to put your thumb on the outside, so you've got kind of a little point there. You're going to reach around them just above the belly button. Do not do this to yourselves, because a bunch of you just eat pizza, and I don't want to see the pizza appear again. But it's right here, okay? I'm going to set this down for a second. You're going to grab that, and you're going to pull in and up, back up towards you, kind of in a J fashion. So what you're doing is you're pulling up into underneath the rib cage. And like I said, the diaphragm sits right here. What we're hoping to do is put some oomph on that and push the air that's in the lungs out. So it pushes that object out along with them. So we're going to keep doing the Heimlich maneuver and doing the Heimlich maneuver until either the object pops out or the person goes unconscious. Now, once they go unconscious, a couple of things can happen. When we're conscious and choking, our throat is holding on to that object. It's kind of spasming, so it's hard to pull that object out. Once we go unconscious, all of our muscles relax. So where it was hanging onto it before, it's now kind of relaxed. We might be able to pull it out fairly easy. So if they don't start breathing right away, which they can once they go unconscious, we need to look for that object. So we're going to grab the nose and kind of use it as a handle. Pull that head way, way back. Then with this other hand, we're going to take our thumb, we're going to go into the jawbone, and we're going to pull it down. So we've got this mouth as open as we can. We're going to look in there. If we see something, we're going to pull it right out. Okay? If they start breathing, fantastic. Turn them on their left side and wait for help to come. If they're not breathing, then we're going to start CPR, which I'm going to talk about in the end. But that's adult choking. Now, child, for what we're going to talk about today, we're going to consider a child anyone between the age of 1 and 8. Mostly based more on size than their actual date of birth. But for a child, choking is exactly the same thing. Except for the Heimlich maneuver, we might have to pick them up and stand them on a chair so that we're in that good position, or kneel behind them so that we're in the right position to do that Heimlich maneuver. We do that until it either comes out, until they go unconscious. If they go unconscious, same thing. We're going to really get that mouth open, see if we can pull that object out and get them breathing again. The one that's a little bit different is our baby. Because baby's a little bit smaller, so we can pick baby up, and gravity's going to help us out. So now, for babies, they're going to be a little bit blue. They might be kind of whistling, coughing, but you can obviously tell they're just fighting. So they're going to be really flopping around, having a hard time breathing. So we're going to pick them up. Anytime you pick up an infant, you want to make sure that you have good control of the neck. So you would pick them up like this. Then you're going to sit down. And the reason you're going to sit down is kind of twofold. We're going to get them upside down. Okay, gravity's going to help us out. But they're not still like this little doll. They are flopping around and fighting you, so it's easier to hang on to them when you've got them like this. And once we get them like this, upside down, we're going to give 5 back blows. So I'm going to show you what that looks like. The heel of your hand, 1, 2, 3, 4, 5. You notice it's not like, oh, I'm just trying to hurt them. There's some force there. Because again, what we're trying to do is take the air that's already in their lungs and force that out to push that object out. Then once we do those, we're going to turn them over and we're going to do 5 chest thrusts. So again, hold on to that head, flipping them over, still keeping them upside down. 1, 2, 3, 4, 5. And you can kind of hear that some air rushes out there. We're going to keep doing this back and forth, until either the object comes out and baby starts to scream. In that case, we're like, okay, someone else take baby. Or until they go unconscious, they just kind of go limp. And then it's the same principle. We need to get into that mouth and see if there's something right there. But if you notice, baby's mouth is a lot smaller than an adult's mouth. So we're still going to tilt this head back. But then to get the mouth open, we're not going to stick our thumb in because that's going to push whatever's in there down further. We're just going to go right on the chin. Just pull that chin open. If we see something, sweep it out. If they start to breathe, great. Put them back upside down because there'll be fluid and things like that that will kind of help drain out. If they don't start breathing or you can't pull that object out, then we're going to start CPR on them, which we'll talk about later. So that's really the only difference, is that with the infant, we can pick them up and gravity can help us out a little bit. So does that make sense to everybody? There's a couple special circumstances with adult choking. If you have someone that's pregnant, baby's in the way, you might not be able to reach around to get in that position. So we do what we call the chest thrust with these folks. So you're going to put your hands right underneath their armpits, which is going to put your fist right here in the center of the chest. Then you're going to grab that, and you're just going to pull straight back towards you. Now this is harder to do because we got bone and muscle and stuff up here, but again, we're just trying to get that on the lungs to kind of push some of that air out. If you're by yourself, you can do the Heimlich maneuver on yourself by taking this part of your abdomen and pushing it against a table, a countertop, the back of a chair that's up against a wall, just so you get some sort of impact right here again to try and push some of that air out. The other thing is, what if it's a large person and you just can't reach all the way around them? Well, there's 2 things we can do in this instance. We can either treat them like the pregnant gal and come up here and do that chest thrust. We can say, hey, we got to push you into the countertop. So get them towards that object and help kind of force their abdomen into that. And really put some force in there. Take out all your frustrations and just push them in there to try and get all that air out. Because, we're going to save a life that way. So that's choking. Another breathing thing that can come up is when people have severe allergies. So now there's just kind of the regular, everyday, annoying allergies like to dust and things like that. You cough, your eyes run, or you go roll around in all this nice grass we've got growing right now, and you get kind of those little pricklies. It's annoying, but not life-threatening. But there are a lot of folks that have life-threatening allergies, like allergies to different foods, to strawberries or nuts is a big one, things like that. It could be to medications, to penicillin, something along those lines. It can be to different venoms, bee stings, scorpion stings. Severe allergies are a real problem because it involves our airway. So what you'll see happening is the person will get like these red splotches on their face and maybe on their chest and things. Those are hives. And then you'll see, wow, their lips are starting to swell. And their nasal passages are swelling. And then back inside their throat where you can't see, their tongue is swelling and their throat is swelling. And all of that will swell to the point that it closes and they can't breathe. So if they're very far into that, they almost might sound kind of whistly in their breathing. So we want to go up to them and ask and say, hey, you look like you're having an allergic reaction. Do you have an EpiPen? Do you have any medicine that you take for that? Most people that know they have a severe allergy will carry an EpiPen with them. Now this you can only get by prescription. The doctor has to write that. Usually comes with 2 in a pack. And this is a trainer. There's no needle or anything in this. They don't all look exactly like this. This will kind of give you the general idea of how to use it. If they're conscious and awake enough, you might just, help them. They'll probably be able to use it themselves. But if they're really kind of getting unconscious or they are unconscious, you're going to have to do it for them. So you take it out. There's going to be a cap on the front end, and there'll be a needle, but it's up inside here, so it's not like going to be exposed. Some of them have a safety mechanism on the back. You have a back cap. You have to take that off, otherwise the medicine won't dispense. Then you're going to take that with your hand. It's meant to go through clothing. It'll even go through really tough jeans. And just kind of in the middle of their thigh, so kind of in this part right here, you're going to take it and hit them with it, and it'll make that click. Then you want to count to about 10, and it may click again to tell you that it's done. It may not, but if you've counted 10, you know it's dispensed. Take it straight out. Now the needle should still be back up in here, but don't touch that end. Set it down where no one can mess with it. And then you're just going to rub that area. Rub that area a little bit. And within a minute, and I mean 60 seconds, that person will go from to perfectly normal breathing. Epinephrine works very, very quickly, and it's amazing. We still need to call 911. This person still has to go to the hospital because in about 20 minutes, they'll have used up all that epinephrine and the swelling will start again. That's why it usually comes in a 2-pack, because if it's going to take more than 20 minutes to get them to the hospital or to help, you may have to give them that second shot. Some folks may not have it. If you don't have it, call 911 right away and just hang out with them until help arrives. If they stop breathing, we can start CPR, but they're going to have, nothing's really going to change until we can get that epinephrine into them. Now, some folks do not carry these around because they're extremely expensive. A few years ago, they went from like $75 to over $750. They've come down a little bit, but for a lot of people, it's still $200 to $300. So this is, if you know anyone that has a severe allergy and they don't have the EpiPen because they can't afford it, please tell them to go back to their doctor and have him just write the prescription for the epinephrine. It's like $7, and it'll be the 2 little vials and 2 syringes. The reason they've made this is because people don't like having a syringe, like, oh my gosh, I have to give them a shot. And we always think about a needle that's like this big around and this long, and it's got like barbs on it, and it's rusty. It's a little tiny needle, and it's really easy to use. So if you ever run into this, you take the little bottle, flip the plastic cap off, take the cap off the needle and the syringe, stick it in there and draw out all of the medicine that's in there. It's 1 dose. And you're going to do the same place in the thigh, right there. It's a little short needle. Just pop it in the skin, push the plunger in, take it out. Now this is really important. You have an exposed needle. Set it down where no one's going to touch it. Do not try and put the cap back on it. That's when we stick ourselves, because our adrenaline's flowing and we're a little bit nervous, and we're trying to get this little tiny cap on this little tiny needle, and we're going to poke ourselves. So just set it down. The fire department will dispose of it for you. But again, rub that, they'll be fine. It's just folks don't like the idea of that needle. I usually have some people say, oh my gosh, but what if there's air in it? Doesn't matter. We're not going into a vein. You're just going into tissue. You cannot hurt them. And epinephrine's not going to hurt anybody either. If they're not having an allergic reaction, you end up giving them their epinephrine. It's not going to cause them any problems. So that's allergic reactions. Another thing that has breathing issues tied to it is heart attacks. So typical signs and symptoms of a heart attack. Typical. Chest pain. Okay? Pain that radiates. It can move. Like typically it's going to go into the left side. It can make your arm feel numb and tingly. Now that pain can radiate into the right side. It can also come up the neck and into the jaw, or it can kind of go back into the shoulder blades. Another really big telltale sign is chest pressure. Oh, it feels like there's an elephant sitting on my chest, or it feels like my chest is going to explode. My chest feels really tight. These people will be breathing very shallow because it hurts to take that big deep breath because their chest hurts. So they may be kind of sitting forward, focused on it, like that. Their color is going to be a little bit off because they're not getting real good oxygen, so they're going to have that kind of gray pallor to them. They're going to be cold and clammy, so they'll be a little bit sweaty, but it's not that I've been outside in the heat sweat. It's that kind of I'm sick kind of sweat. They're going to be really nauseous, feel like vomiting. They may vomit. And then there's denial is another really big sign, because we don't want it to be a heart attack because that's really scary. So we're thinking about all of the other things that it can be. Oh, it's just acid reflux. It's from that salsa I had with lunch or something along those lines. And then the last one, and this may sound kind of harsh, but it's true, is a feeling of impending doom. If someone says, oh man, I think I'm going to die, that's something we really want to pay attention to. That little voice is telling them something, so we want to make sure we call 911 right away. Now, those are the typical signs and symptoms for a heart attack in a male. And I don't like to play the gender card, but when you're talking about physical things, we kind of need to. The most common signs and symptoms in a female are fatigue, which for a lot of us, that's kind of a normal thing. I'm tired, I don't feel good. Chest pain for women usually comes down and sits more here, kind of in the lower chest or almost on top of the abdomen, which for years and years was misdiagnosed as, oh, it's your gallbladder, because people didn't think that women had heart attacks. And actually now we've kind of bypassed men in the numbers of heart attacks. The other folks that can have some odd signs are folks that are diabetic or older folks, because their nerves just don't function the way that they used to. So they might have, I've heard a lot of folks say that it's like a burning in the back of your throat, which definitely makes you think, well, it's just acid reflux. It's something spicy that I ate, but it is that heart attack that's happening. So let's talk about what a heart attack actually is. So your heart's about the size of your fist, okay? It's over here just about on the left side of your chest, right about there. Now there's 7 cardiac arteries that give that heart muscle oxygenated blood. Your heart's completely made up of muscle tissue. If we have a blockage in one of these arteries, then that part of the heart, it's not getting any oxygen. And after a certain amount of time, that muscle tissue will die. And when muscle tissue dies, it turns into scar tissue. Now our heart needs to be really stretchy so it can beat. So if we've got this big patch of scar tissue on there, scar tissue doesn't stretch real good. So that means we're not going to have very good cardiac output. And that can be a life-changing event right there. So we want to fix the problem before that muscle tissue has a chance to die. So that's why we need to recognize the signs of that heart attack and get the person to the hospital. So again, if we have this person that's sitting there, it's like, oh, my chest hurts, I don't feel very good. We're going to go up and we're going to say, okay, you're going to be all right. I'm going to go call 911. I'm going to grab the first aid kit, and I'm going to come back. You guys have some homework. This isn't anything you're going to have to turn or even ever contact me to tell me about, but I want you guys to think about this. Everybody should have a first aid kit at home. You should also have one in your vehicles. If you go hiking and things like that, you should have one that you can throw in your backpack. And then in that first aid kit, I want you guys to buy and put in there a bottle of aspirin. The cheapest bottle of aspirin that you can find that's not coated. that you look at the bottle and it looks like the powders, they're kind of coming apart in the bottle. You know when you take it, oh, it's going to taste awful. Because this is a life-saving thing. When we come back, we're going to ask this person, hey, are you allergic to aspirin? If they're not allergic to aspirin, we're going to give them 2 of those aspirins to chew, not swallow. If they swallow them, it's going to take about 20 minutes to get in the bloodstream, and that's really kind of a long time. But if you've ever looked in your mouth, like underneath your tongue, you've got all these vessels. And so anything that dissolves in our mouth, a little tiny brown bottle with them, they'll have these little bitty pills in them. They're nitroglycerin. You put that underneath the tongue, it dissolves. What that does is it's a vasodilator. It takes all of your veins and arteries throughout your whole body and opens them up. So now this vein's bigger, this artery's bigger, so now we've got that blood that's reaching that part of the heart. We can keep it alive until they can get to the hospital and get the real problem taken care of. Other than that, we're just going to hang out with them until help arrives, but we want to be ready to do CPR. And what that means is we need to think about what we're going to do if this person stops breathing and goes unconscious. That means we're going to put them on the floor. CPR has to be done on a flat, firm surface. Today we're going to practice on the table because we're going to be kind to our knees, or you can put it on the floor if you want to. But you really have to put them on the floor, because what we're doing is when we do that compression, that's pushing down on the heart and it pushes all of the blood out of the heart. When we let up, it refills. And so that's what's getting it to circulate. Where do we go when we don't feel good? We lay down on a couch, we go lay down on a bed. If you're doing CPR on someone that's on a cushion, you're just pushing the whole body into the cushion. You're not getting that squish of the heart. So it's really important that they have to be on the floor, essentially. All right, let's talk about the next couple things I want to talk about. There's really not much that we can do other than recognize the problem and call 911. So the first one is a stroke. The stroke is to the brain just like the heart attack is to the heart. There's a part of the brain that's not getting enough oxygen because it's not getting any blood. So we want to respond to a stroke fast. F-A-S-T. That's the main thing to remember. If it's a stroke, we have to help them fast. And that helps us recognize what a stroke is. So a stroke affects us neurologically. It usually affects just half of the body. So the F in fast stands for face. Look at their face. Half of it is going to look like it's sagging or it's fallen or it's hanging down. So the one eye is going to kind of be hanging down. The mouth will be kind of hanging down. The cheeks will kind of look like they're drooping a little bit. But their face is not going to be symmetrical. So that's F is face. A is arms. Ask them to raise their arms. Their arms will not track together. One may not work at all, or it may only kind of partially work. So F is face, A is arms. S is speech. When we talk, we use our tongue, which is a muscle, and the muscles in our lips to actually form the words. So if half of that's paralyzed, they're not going to sound right. They might not be able to talk at all. And then T is just time. We've got to get them to the hospital. The quicker we get them to the hospital, the better off their chances of our survival and survival without some sort of permanent paralysis. That's all we can really do. So recognize it and call 911 immediately. The next thing is seizures, and there really isn't much that we can do for seizures either other than recognize it, keep them safe, and call 911. So a seizure is a loss of muscle control. It can be from a twitch to the whole body kind of shaking and seizing. The person might be hitting their head on the floor. It can also be that they just kind of get really stiff and kind of posture. Seizures can be caused by a multitude of things, low blood sugar, a head injury, heat stroke, epilepsy, all kinds of different things. So what we can do, we recognize the person's having a seizure, we call 911. Then if there's stuff in the way that they're kind of running into, we're going to move that out of the way. And while they're seizing, that's it. We're not going to touch them. We have to let them seize. Once they stop seizing, and they will, it'll seem like a long time, but it should be less than a couple of minutes. If they're breathing, awesome. Turn them on their left side, kind of hang out with them until help arrives. If they're not breathing, we're going to start CPR on them. But no, if we start CPR and they start to seize again, we have to stop and let them seize. And then when they stop seizing, we can go back and do CPR. It's a really scary thing, but it's hard. It's really hard, but that's really all that we can do. So let's talk about bleeding that we can see. So we're going to get our rubber gloves on wherever the injury is. We're going to grab some gauze and we're going to put good, firm, solid pressure on that for about 10 to 15 minutes. Once that time's up, we need to look and see if they're still bleeding. Take your hand off the gauze. If it looks like they've bled through, get some more gauze, go back on it, and go back to that direct pressure. It's really important to fight human nature because we want to look to see if it's bleeding, so we want to look because it could be kind of cool, it could be gnarly. But when you do that, you've just taken off the scab or the blood that you've clotted, and you're back to square one. So just keep adding to it to stop that bleeding. It's up to you as to whether or not to call 911. It's going to depend on the location of the injury, the size of the injury, and the person. If you have someone that's had a heart attack and they take an aspirin a day or they take blood thinners, that person probably is going to have to go to the hospital to get that taken care of because their blood doesn't clot like everyone else's. So just be careful, cautious around that. Couple special circumstances, nosebleeds, really common in Arizona because it's dry air. And again, with nosebleeds, we want to fight human nature because human nature is, oh, look, it's not bleeding anymore because my head's back. Well, it's still bleeding now. It's just draining down your throat, and you're going to end up vomiting blood. Nobody wants to see that. So what you really need to do is sit forward, pinch those nostrils, pinch them hard for about 10 to 15 minutes. Then let go. If it goes back to bleeding, go back to pinching them again. You can also go right here under the nose. This is a really good pressure point. You can put some ice on the back of the neck. All of the blood that enters into the head comes right through here, and the ice will actually kind of slow the blood flow down a little bit, which can help things kind of clot a little bit. Now, another thing that you can add into this first aid kit is a tampon. Somebody's got one of those, you have a nosebleed, you just kind of stick that right up the nostril. Looks a little silly, but man, it puts direct pressure on it and stops that bleed, so it can really make a big difference for them. The other thing is bleeding in the mouth. You're going to get your hopefully sterile gauze. You're going to hand that to the person, have them sit with their head down, and have them put direct pressure on the wound. Never, ever, ever stick your fingers in someone's mouth. A human bite's much worse than a dog bite. You can put some ice on the outside that'll kind of help slow things down. But if it's a lip or a cheek injury, it should seal up pretty quickly. It's going to look like a lot of blood because we're really vascular there. But if it's a tongue injury, I would call 911. Anytime that we cut our tissue, the tissue around the injury is going to swell. And your tongue can swell to the point that it really becomes an airway problem. So I would just err on the side of caution. It doesn't cost anything to have the fire department come out and let them decide if, yeah, it's okay, or no, we really need to go to the hospital with that. Internal bleeding, we're going to suspect an internal injury anytime that there's been an impact, a fall from a height. Someone's playing baseball and they throw the bat and it hits someone. Anytime that you see a bruise that's starting to appear on the chest, on the abdomen, or in the thighs, those are areas that we can lose enough blood that it can be life-threatening. So think about all the folks that ride quads. And you're riding and you go into that ditch head first, and all of a sudden the quad stops, but your body comes up and your legs hit those handlebars. That can cause internal bleeding that could be life-threatening. So now, really all we can do is call 911 and keep that person comfortable, because we can't like reach inside to put direct pressure on wherever that wound is. We may want to cover them up with a blanket. They may say they're cold, even when it's 110 degrees outside. Because the body does some really cool stuff. When it realizes that it's losing blood, it says, oh wait, we need to keep our organs alive. So it kind of reroutes that blood that would go out into your arms and your legs and pulls it into this part of your body a little bit. So their arms and their legs, they might feel kind of cold. So cover them up. Try and keep them still from moving if you can, and then just wait for help to arrive. If they stop breathing, then we're going to start CPR. Another thing with impacts is we want to think about head and neck injuries. What makes us breathe is our diaphragm. The nerves that work our diaphragm are right here in the base of our neck between the third, fourth, and fifth vertebrae. So if we damage the spinal cord right there, that's kind of the end of things. So we want to stay away from having to move someone. Sometimes you may think, oh my gosh, but I have to move them. They're next to the car and the car's on fire and it's going to explode. What do I do? Oh my gosh. Okay, probably should try and move them. You can move them fairly safely by splinting their neck and pulling them in a straight line. So I'm going to show you how to do that. Grab their shoulders, take your forearms, and grab that head, and then you can just pull them straight. That's going to really kind of keep their head still when you've got it wedged in between your arms like that. If you don't have to move them, don't move them. If you come upon this, it's a motorcycle or a bicycle accident, they have a helmet on, leave the helmet on. Don't try and remove it, because think about how much you're going to have to manipulate that neck to do that. So even the paramedics will not take it off. They just tape them down with that on. They'll remove it later at the hospital. Broken bones and sprains, we really need to go to urgent care or the emergency room because they need to get x-rayed. We don't have x-ray vision. The most important thing is that we want to keep them still. We want to splint them because every time that area moves, it hurts. So things that make good splints are rulers, yardsticks, tree branches, anything that's stiff that you can tie to that area to keep it still. Pillows make really good splints because you can kind of form it around there to kind of keep it stable. The body makes a great splint. If that arm's injured, bring it into the chest and tie it down with pantyhose, hay string, duct tape, whatever you've got to kind of stabilize it. If you've got one leg that's injured, tie it to the other leg. That'll kind of keep it a little bit still. You can put ice over the deformity. That'll kind of help with pain a little bit. But, you know, it's up to you as to whether or not call 911. If it's, you know, I know years and years ago when my son broke his arm, I'm like, it'll be quicker to just put you in the truck and we'll take you to the ER. When my neighbor fell and broke his hip, it's a 2-hour bumpy dirt road to get to my house. It's like, yeah, we're calling an ambulance for this. So it's kind of up to you to make that decision, but they do need to go be seen somewhere. The last thing I want to talk about before we're going to talk about then environmental stuff and then CPR is burns and electrocutions. What do we tell someone who's on fire? Stop, drop, and roll. Awesome, you guys. We learned that from when we're really young from the firemen. So, because you got to smother those flames out. Here's the problem. Someone that has been in a fire is on fire, they're usually going to be running because they're scared and they're not remembering stop, drop, and roll. So you got to holler at them, stop, drop, and roll. Get on the ground, roll around. And if they're not, you have to knock them down. And that sounds so mean, but you've got to get them on the ground, take something, get those flames out. If you've got a water source, get them wet. And then be ready to do CPR on them, because anyone that's been involved in a fire has inhaled super, super hot air and poisonous fumes that can cause your lungs to build up fluid and can cause you to stop breathing. Now in electrocution, if I'm touching a cord and I'm being actively electrocuted, you cannot come touch me to help me. You cannot grab the cord and try and take the cord out of the wall, because as soon as you touch either me or the cord, you're also being electrocuted at that point and you're stuck. You can't let go. Electricity makes our muscles contract and contract at 100%. So that's why I can't let go, and then you're also stuck. The only thing you can do, call 911 and then go find the main power panel to wherever you're at and shut it down. Shut everything off. Once the power's off, then you can go help this person. And a lot of times they're going to need CPR. Our heart beats because we have our own electricity. And outside electricity is going to cause it to do one of two things. It's going to cause it to stop beating, or it's going to cause it to fibrillate. It's just bouncing around, but it's not pumping. So you may have to do CPR on these folks. Lightning is electricity. And we have some just crazy monsoon seasons here in Arizona. We usually have at least one person that loses their life due to a lightning strike every year. If the person's outside and they've been struck by lightning, if you can pull them into a shelter to help them, to work on them. Because lightning can strike twice in the same vicinity, and it doesn't have to hit you directly. It can hit over there and travel through the ground and still kind of snag you. So be really, really careful around electricity. So let's talk about the environment. So Welcome to Arizona. Everything's going to bite you, sting you, scratch you, poke you, poison you, but it's a dry heat, right? So the heat's there too. So let's talk about bites. Hang on. I got too excited with the electrocution. There we go. Sorry about that. Let's talk about bites. Dog bites, other animal bites, human bites happen too. We do have rabies in Arizona. Rabies is a very, very serious, deadly disease. We mostly see it in bats, and usually foxes are the other ones that kind of carry it the most. But it can be in a squirrel, it can be in a mountain lion, it could be in the little chihuahua that lives next door. Any animal bite, the wound, soap and water, ice, go to the doctor, go to the ER, go to urgent care. You're probably going to at least need to be on some antibiotics or something because of that wound. Do not try and capture the animal. That's what law enforcement is for. That's what Game and Fish is for. That's what the firefighters are for. They're trained in ways to do that. You can say it went that way. Any animal that's bitten someone is scared and agitated and will bite at the next person that they see, and you don't want that to be you. If perchance the animal has passed away, do not pick the animal up to transport to the hospital. Let the authorities do that, because if you touch the animal, even if it doesn't scratch you, if you touch it and it's rabid, you get to have the shots too. And the shots that fix the problem are like 20 shots in the abdomen. It is not a fun time. And I know this is an absolute fact. I had a friend of mine that lived in Yuma, and they would sit out at night and watch the bats come dip into the pool to get moisture. And one of those missed and hit her sister's foot and scratched her. Dad was right there, and he whacked it down with, I don't know, a broom or a pool thing. Mom picked it up very carefully and put it in a paper bag, and they went to the ER. Mom was not scratched, scraped, or anything by it. It did test positive for rabies. They both got to have those shots. So just be really cautious, and especially if you see like a wild animal out during the day. A fox should not be out roaming around and doing things during the day. Something's probably wrong with them. Call Game and Fish or call animal control or something to let them know, hey, I think we've got, a sick animal over here. Rabies is really, really dangerous. We have snakes in Arizona. Snakes are not my friend. But we do have poisonous and non-poisonous snakes. Rattlesnakes are the biggie. There's about 12 different types of rattlesnakes in Arizona. What you guys will see around here most likely is the diamondback rattlesnake. Everybody should be really familiar with that. You might also see the sidewinder, which you'll see in the washes. They actually do kind of move sideways. Those are rattlesnakes. We do have the timber rattler around here if you get it kind of in the trees. You may have already stepped over one and not known it because they really do just kind of look like a branch. We also can have the Mojave rattlesnake in this area. He's kind of a little green looking. That is the most venomous of all the rattlesnakes. We also have the coral snake and the king snake. The coral snake, these look very much alike. They're a thinner kind of snake. There's bands of color around them, usually red, black, and yellow. Coral snake, very venomous. King snake, very not going to hurt you. There's little ways to tell the differences. I don't talk about that because I'm going to tell you guys a lie. It's the only time that I ever lie, but I want you to believe it with your very core. And that's all snakes are poisonous. If we believe that in our head, we're not going to see a snake and go up and say, oh, hey, are you a good snake or a bad snake? And possibly get bit, because even the bite from a non-venomous snake is going to have bacteria in their mouth that can just create a lot of problems for us. So leave the little snakes alone. If someone gets snake bit, for the wound, soap and water, ice, go to the hospital. You do not need to take the snake with you. You do not need to take a selfie with the snake to post on Instagram. If you can take a picture of it from a distance, that's cool. Our cameras zoom in, so you don't need to get up and close. If you can describe it, that's awesome. If it's a venomous snake, the anti-venom that they use is universal. It's the same anti-venom no matter what the snake bite is, so we really don't need to describe it. And again, snakes are just like dogs or other animals. Once they've bitten someone, they're agitated and they're ready for the next person. And rattlesnakes are really sneaky. They dose their venom. So they're going to give this person a little bit. They're going to save some for the next person if they're an adult. Baby rattlesnakes are much more dangerous than adult rattlesnakes. People think they can pick them up because they're little and they might think they're cute or whatever. They've not learned how to dose their venom. They bite you, boom, everything that they've got, and that can be very, very deadly. So just be super cautious around all of the snakes that we have. We do have scorpions here in Arizona. Most folks are not allergic to scorpion venom, but some are. Cool thing is there is an anti-venom for scorpion stings, and it was actually developed here in Arizona at the U of A. They're super, super proud of that. If the person's been stung by a scorpion, watch them for the first 20 minutes to make sure they don't start to have an allergic reaction, breathing problems and stuff like that. If they do, we need to go to the hospital. For the most part, it's going to be really hot, red, swollen, burning pain that can last for 3 or 4 days. There's a real spectrum for folks with scorpion stings. Some people it doesn't really bother at all. Other people it's like really, really bad. So if the pain's really bad, you can go to urgent care or the ER. They might be able to help you out, but you're probably just going to feel really crummy for a couple of days. We also have a couple of really nasty spiders here in Arizona, and the first one I'll talk about is the black widow. Now the black widow venom is a nerve agent, so you might not feel it when it stings you, but then about a half an hour later you can be like, oh, what is that? And you'll see like a little red dot. That's the good part. The bad part is for the next 24 to 48 hours, you are probably either going to be vomiting or you're going to have some really bad diarrhea, which is always really exciting. And then back pain. Some people, me, have said that back pain's worse than childbirth. And again, there's a big spectrum. Some folks, the venom doesn't bother. Some folks, me, it's awful. I've been stung like 4 times. These things seek me out. I don't know what it is. But I hate those. And then we also have the brown recluse. Now there's some people say, oh, we don't have those in Arizona. We have these in Arizona, and they are very, very problematic. The venom in a brown recluse is necrotic. It's flesh-eating. So again, you're not going to feel the sting, and then you might see like a little blister. And then that blister is going to continue to get bigger and bigger, and it's going to turn into a crater. The only way that they can stop it from growing is to surgically remove it, which means they got to go past the bad part into the good part and dig that all out. People have horrendous scars from this. You can lose muscle tissue from this. A couple years ago, I was teaching CPR at a high school in Tucson, and there was 2 different youths in different classes that were just getting over this, and the one girl was missing like a piece of her bicep from it, and the young man it was his calf, and I mean, it was just a horrendous scar. Be really, really cautious around spiders, dark places. Take a broom, sweep things off, bug spray, put gloves on if you're getting firewood for some reason. When it starts to get warm, people are going to want to check their pool filters and things like that. Put some gloves on. Use the little flashlight that's on your phone to look into something before you go sticking your hand in it. Just don't blindly stick your hand into something. If you're going into a shed that you haven't been into for a few days, bang around on it to wake the snakes and everybody else up so you can scare them and get them to vacate. Because we just have some of those nasty little things. So the last 2 things I'm going to talk about before we go into CPR is hot and cold. So I'll talk about cold first because I think our cold is kind of done for the year. The 2 things that can happen with cold is frostbite and hypothermia. Frostbite's a part, fingers, toes, nose, earlobes, things like that. Those can freeze. Get the person in, out of the cold, dry them off. If they're wearing jewelry, take their jewelry off if you can, because when things start to thaw, they'll kind of swell. And then that's it. Don't do anything else to the parts. There's a lot of old wives' tales, oh, put it in cold water, no, put them in hot water, don't do anything. All that's going to do is cause them excruciating pain. Put a blanket on them, keep them warm, but they've got to get to the hospital. Hypothermia, the whole body gets cold. Sometimes it can get cold enough to where the heart stops. that's the case, we're going to do CPR on that person. But if they're shivering and they're really cold, we're going to get them in and out of the cold. We're going to get wet clothes off of them. We're going to get our first aid kit out. There should be a little foil blanket in there. Unfold that foil blanket. Once they're dry, wrap them up like a baked potato, because that will start to reflect what little body heat they have and start to warm them up. But if they're wet, if they're damp, and we put that foil blanket on them, we're just holding the cold in. So they've got to be really, really dry for that to be able to work. Now, heat problems. It gets really hot in Arizona. You guys know that. It's going to get really hot here soon. There's two things that can happen: heat exhaustion and heat stroke. Heat stroke is deadly. It's very, very dangerous. Heat exhaustion is what happens first. You're outside, you're like, oh man, it's really hot. You're sweaty, you're thirsty, you're kind of like starting to feel a little bit woozy in your stomach and maybe a little bit dizzy. That's heat exhaustion. That's a clue. Get in out of the heat. Get that person in the shade or get them in a building. Loosen their clothing. Get them wet. Fan them off. Let them sip on some water. We've got to cool them down. If that person doesn't get out of the heat and they stay in the heat, they're going to get hotter and hotter. Once your brain reaches about 108 degrees, we lose our ability to sweat. This is heat stroke. This is what's dangerous. Sweating is good. Okay, so our skin gets wet, the air passes by, the blood that's right there on the top of our skin cools down, and the body circulates that cooler blood. When we can't sweat, we can't cool our blood down. Now these people are going to be bright red because the body is pushing as much blood out to the skin as possible in an effort to cool down. So be bright red, they're going to be dry. You're going to feel heat radiating off of them. They're going to be extremely dizzy, incoherent. They will eventually have a seizure and then they can die. So once we notice red, hot, and dry, get them out of the heat. Get your first aid kit. Loosen their clothing. Spray them down. Fan them off. Once somebody shows up with that first aid kit, there should be an ice pack in there. Pop that, get it cold, put it to their bare skin in their armpit. If you have a second one or you have some ice, the other armpit. If you have more ice, in the groin area. If you have more, the back of the neck. These are the 4 areas that we can kind of start to cool that blood down a little bit, but we can't get it back to where it needs to be. They have got to go to the hospital. There's some really weird things that they do to bring that core temperature down. Now, if someone's lucky enough to survive heat stroke, there's permanent changes for that person. They can no longer tolerate temperature change, hot or cold, because it damages the amygdala, that little center part of your brain that regulates essentially your temperature. So it is a life-changing event. It's very dangerous. Always make sure if you're outside, you've got water. Stay well hydrated. If you're starting to get hot, get in the shade, get cooled down somehow. If you know, oh, hey, we're going to go hiking tomorrow, start drinking water today and take extra water with you. You always want to stay hydrated. That can definitely help with heat stroke. So that was a whole lot of information in a very short period of time. Any questions on any of that? You guys are still here, right? Okay. All right. Let's talk about CPR. Let's have you practice CPR and give you your night back. CPR. The most important part of CPR are the compressions. They're deep and they're fast. But that is the most important part. When we come up and someone's unconscious, we want to try and wake them up because we don't want to have to do CPR. So we're going to be like, hey, are you okay? Are you all right? And then we're going to holler, help! Because I don't want to be here by myself. I need some help with this. Someone shows up, you're going to say, hey, you, call 911. You, get the AED. Get in the habit of talking about an AED. We're going to talk about the AED in a minute. If you have more than one person show up, use your little pointer finger and say, hey, you, call 911. Because what happens if you have a crowd of people and say, hey, somebody call 911. I'm going to assume that person's doing it. I'm going to pull out my phone, I'm going to film it. I'm going to assume they're going to do it. But if you point at somebody, that person's like, oh, okay, and they'll call 911. Then we're going to remove the clothing, okay? CPR has to be done skin to skin. We need to be able to see some of the landmarks on the body. If clothing's there, we can slide around on it and not do good compressions. And then that way the clothing's out of the way for when the paramedics get there or someone shows up with an AED to do that defibrillation if they need it. Even if it's a gal, she's not home right now. Get that clothes up and out of the way. Then we need to find where we're going to start our compression. So you're going to feel, I'm going to turn it to the side here. You're going to feel up the ribs to where they come together. And then you're going to go a finger above that, because right down there. So the heel of your hand is going to be right here, right in the center of the chest. Okay, right on this breastbone, right here. And then your hands are going to go together like this. You're going to lock your elbows, and you're going to do your compressions. This, bending your elbows, is not a good compression. You want to lock your elbows, and you're kind of actually bending at the waist. So you're using your kind of upper body strength and weight to kind of fall in on this person to do this compression. CPR is physical. It's hard work, so you want to make it as easy on you, and you really want to do a good compression. So you do 30 of those compressions, and I'll show you in a minute after I talk through and I put the microphone down. And then we need to do 2 ventilations. So we need to open the airway. What happens when we're unconscious is the tongue kind of falls back against the throat. And your tongue is attached to the lower jawbone. So you're going to pinch that nose and pull that head back. That's half of opening that airway. It's very important to pinch the nose. If you don't, when you give that breath, the air is going to come right back in, out the nose, onto your cheek, along with all the mucos that are in the nose. Nobody wants that. So this other hand is going to grab this jawbone and pull it up. That's what really lifts the tongue out of the way. You're going to give 2 breaths, you're going to come back, and you're going to do 30 compressions. 30 and 2, 30 and 2, 30 and 2. So let me show you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very, very fast. Push that, pull it up, 1, 2, and come right back. You notice I have my hands like this. You can do your hands like this. I can't do that anymore because I have arthritis in my wrist. So whatever is the most comfortable position for you, but you want to be right on top. You don't want to be leaning over and doing that. You want to make sure that you're right in the center, okay? So like I said, that's how I hold my hands because that's most comfortable for me. That is adult CPR. Child CPR. Remember, our child is 1 year old to 8 years old. It is the exact same thing, but with one hand. They're smaller. So I'm going to go 30 compressions, 2 ventilations, 30 and 2, 30 and 2, 30 and 2. Okay, super easy. Everybody's the same. Baby is a little bit different. We are going to pick baby up and put baby up onto something that we can reach, because if we try and do baby on the floor and we're kneeling, we're not going to be able to reach them. Now, it's the same position right in the middle of the chest, but we're going to approach baby a little bit different. Baby's unconscious. We're going to come up and we're going to flip baby on the foot. They don't like that, and that usually makes them mad. So if you got that baby that's just really kind of just zoned out and kind of forgotten to breathe, flipping the end of their foot can be enough to make them scream, like, yay, they're breathing, this is great. Then we're going to come up and we're going to do 30 compressions with 2 fingers right in the middle of the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, up to 30. Then we need to open the airway. Now, if you notice, baby's face is pretty small. This is a small infant. If I try and pinch the nose, my fingers are almost in baby's mouth and I'm not going to get a good seal. So we're going to cover the whole mouth and nose with our mouth. We're going to tilt the head back. We're still going to lift that chin up, but then we're going to go with just like what we could put in our cheeks, and we're going to go puff, puff, covering the whole mouth. And then we're going to go back 30 and 2. 30 and 2. Now, you might have a big infant, and you're like, oh, I have a small mouth. I've never been accused of that. And so you can't reach both of them. Then you can pinch the nose. So it's really about what works best for you. You might have an 8-year-old. You're like, man, this kid's pretty big, and I'm not the strongest person in the world. I might need 2 hands on that kid. Well, that's great. You might have a little, tiny, frail, older person that if I use 2 hands, I don't need to do that. I can do it with 1 hand, so that's fine. So it's not really, don't worry about their age. your physical ability and their physical size, whatever's going to work best to do that is what you're going to use. You might start off with one hand and be like, this is great. And you're like, okay, I'm getting kind of tired. I'm going to add my second hand in. Now, usually I have people say, oh, what happens if we break their ribs? You can't break someone's ribs while you're doing CPR, but you can crack their cartilage. So our ribs attach to the sternum with cartilage, like what's in our nose. And sometimes that can snap. It sounds horrible. And in your brain, you're thinking broken bones, they got these shards and stuff, and oh my gosh. That's not it. It's just cracked that a little bit. Just keep going. Usually that happens to the firefighter that's been in that fire truck that's for 10 minutes with the lights and siren, their adrenaline's up here, and they come in, and that first compression is like, oh wham, and that's when it happens. It has happened to me. It's very unsettling, but you're really not hurting the person. Just keep going, because ultimately they need to have that CPR done to save their lives. There's 2 times that we start CPR. When they're not breathing, we start CPR. The second time is if they're gasping. And what that means is you get that, and then there's like 10 seconds, and you get another, If their breathing has slowed down that much, their heart's not beating, and we really need to start CPR. It's hard though, because your brain says, no, they're breathing, and we don't want to do that. But if their breathing is that far apart, we need to start CPR. There's 4 times when we stop CPR. The first one, they start breathing, woohoo! Turn them on their left side, hang out till help gets there. Make sure that they stay breathing, because you may have to go back into CPR. The paramedics show up. Yes, let them take over. You can now sit back and catch your breath. You have another person that comes up and says, hi, I know CPR, can I help you? Yes, take over. Let that other person go. They're going to do 5 cycles. So they're going to 30 and 2, 30 and 2, 30 and 2, 30 and 2, 30 and 2. That's about 2 minutes. Then they're going to stop, and you're going to do 5 cycles. You're going to take turns. That gives you an opportunity to catch your breath a little bit, because it's physical, it's hard work. The last time that you're going to stop CPR is if you're exhausted, if you're in pain, if you're having chest pain and shortness of breath. It's okay to stop. Remember, I said I'm 45 minutes from the closest ambulance. Even back when I was in shape and did this for a living in 115-degree heat, can I do CPR by myself for 45 minutes? Maybe not. And after 45 minutes, is it going to work? Chances are pretty slim. CPR does work. It's an amazing tool, but sometimes it's just not meant to be. If you're at that point, then stop. Don't harm yourself in order to save someone. Now, there is one other thing that I need to talk about with CPR before I show you the AED. As we're breathing into this person, some of the air is going into the lungs, some of it's coming down into the stomach. We're agitating them by doing compressions. More often than not, this person's going to vomit while we're doing CPR on them. I know you guys just ate. I'm really sorry. It's gross. There's no way around it. What you're supposed to do is turn that head over, stick your fingers in, get it all cleaned out, and then go back to doing mouth to mouth. Now, I know a lot of people are like, I am not doing that because that's gross. And I get that. But here's a really neat thing. A few years back, they came up with this thing called hands-only CPR. Now, it's meant to be used in a witnessed cardiac arrest. And what that means is this person's talking to you, oh, my chest hurts, I don't feel good, and they go unconscious, okay, and they stop breathing. Well, we know that their lungs are full of air. We were watching them breathe. All we need to do for this person is circulate that blood for about 5 minutes. So I'm doing compressions and doing compressions. I'm just doing compressions, and I'm still doing compressions. Now, after about 5 minutes, we've really kind of used up the amount of oxygen that they had in their lungs. So we should think about breathing for them. But again, here's the thing. The air that we breathe every day, 13 to 15% oxygen. That's about it. The air that I exhale, maybe 4, maybe 5% oxygen. Are they getting a lot of oxygen when I breathe for them? No, they're getting carbon monoxide. So if you're not comfortable doing mouth to mouth, don't. Just do the compressions, because what that does is that keeps that circulation going, so that when the paramedics get there, they have a little bit more to work with. Because as soon as we stop, as soon as our heart stops beating, gravity pulls that blood down, and it's just sitting there. And so it takes a little bit to get that moving and stuff again. So if we can keep it moving with the compressions, that person has a better chance. If you come on this scene and they've been in a car accident and there's blood and stuff, and you're like, oh, I just can't do it, but I can do compressions, cool. If you're like, oh, I'm not comfortable touching this person, or you just had knee surgery, or your arm's in a cast or something, you can't do CPR. That's okay, because what did I say is the most important thing that you can do to save someone's life? Call 911. So call 911. If there's someone else there and says, hey, I kind of know how to do CPR. Can you try it if I talk you through it? Talk them through it, you know. Don't do anything that's going to make you feel uncomfortable or that you think could harm you. That's extremely important to remember. So the last thing I want to talk about is the AED. Automatic external defibrillator. These are super cool, and they're cropping up in different places all over, which is really nice because they're very expensive, and for a long time we didn't hardly see them anywhere. They're in all airports. I think they're in all shopping malls. Most libraries have them. Some schools have them now. Different government facilities have them, health departments, things like that. If you're walking into a building and you see a sign that is white with a red heart on it, and it'll have like a lightning bolt going through it, and it'll say AED, that means they have an AED on scene right there. And if you're walking into the building with me, I'm going to go, oh my gosh, look, they've got an AED, and then you're going to want to walk the other way from me because I'm embarrassing. But I get excited because these are so amazing for saving people's lives. These essentially do the same thing that the paramedics and the physicians do with their paddles, okay? So you're going to get this, and I apologize, my batteries are not in this one, so it doesn't talk to us. But even if they were, this is a trainer and does not provide any electricity, which is very important. So you'll open the package up, and then you're going to take it out. And they all look a little bit different, but for the most part, they're all going to function the same way. So you would turn it on, and it will talk to you, and it will say, please apply the pads. So it'll come with 2 sets of pads, an adult set, and then a pad that's for children and infants. These are really cool. There's pictures on them that tell you where they go. These are essentially just big stickers. One of them's going to go right here, and the other one's going to go right here. And it tells you which one is which. So we take this one off, and it tells you that this is the one that goes over here. So we stick that on there, and we take this other one off. And it tells you that it goes up here, so we put it there. Now we want to make sure that those are down good because that's essentially they're just stickers. Once it does that, it's going to tell you, and it's checking their heart rate, which means don't touch them at this point, because if I touch them, it's going to check my heart rate and hopefully think that everything's okay. So make sure that you're not touching them. Then it's going to tell you whether or not you need to provide a shock. If it says it needs to provide a shock, it's going to charge, and then when it's ready, that little lightning one, it's going to either be orange or red, will flash. And you're going to push that to give the person that shock. So again, look head to toe, make sure no one's touching them. Make sure you're not touching them because you're kneeling right close to them. And if someone's touching them when you give the shock, they're going to get the shock too. It's not going to kill them, but it is going to hurt really, really bad. So then you're going to provide the shock, and it will tell you whether or not to start CPR. It tells you to go back to starting CPR, leave everything where it is. Go back into your compressions, 30 and 2, 30 and 2. In 2 minutes, it'll tell you to stop, and it'll go through the whole cycle again. So what this does is if that person's heart is fibrillating, it's going to hit it with that electricity, and hopefully the heart goes, oh, sorry, and goes back into its normal rhythm. So, I mean, life-saving device. It is amazing. There's some special circumstances with this as well. If this is a drowning victim and they're still in water, we got to move them out of the water because water and electricity really doesn't work so good together. And also if their chest is wet, if they were a drowning victim, or you've been doing CPR on them, you're probably dripping sweat onto them. We need to dry that off to be able to get these to stick because they're just stickers, so we don't want them wet. If they have some sort of medication patch that is in the locations where we would put these stickers, we need to remove that patch. Do not remove it with your bare hands. There should be rubber gloves in here. Put the rubber gloves on. There should be a little towel. Take that medication patch off with that towel. wipe the residue away with that towel and then put it down. A medication patch is meant to be absorbed through the skin. If you touch that medicine, you're going to absorb it no matter what it was. That could be kind of dangerous to you. If the person has a pacemaker, most of the time the pacemaker is going to be over here on the left-hand side and it's not going to be a problem. But sometimes they do put them over here. So if you see like a little rectangle under the skin, or some of them look like a little stop sign, that means there's metal right there. Or even if you see just like an inch long scar from an incision, we don't want to go there because that metal will stop the electricity. So the electricity comes into this, goes through the body, and exits out this one. That's why you have the 2 pads. So we need to move it. So you can put it more in the center of the chest and leave the other one there as long as they're about an inch apart. But if the person's really small and they're going to be kind of close, you would put one on the center of the chest and the other one on the center of their back, and then you're good to go. The last one, if this is the guy that's got a lot of chest hair, kind of Sasquatchy, we got to remove that hair, because if we put the sticker on, it's just going to be on top. Most of these kits will have a little disposable razor, and you can just dry shave it and put it on, which is great. If the razor's not there, there's 2 sets of pads, because there's the pad for the adult and there's the set for the pediatrics. We're going to take the set we're not going to use, we're going to stick it on, we're going to rub it down, get it really good, and then we are going to rip out as much hair as we can. And I know everybody's like, he didn't feel it, he's not home right now, and later on we can charge him for a wax, but we've got to get that hair out. We've got to do something, because we have to have good contact with that, otherwise it's not going to work. So that's the AED. They're super cool. I hope sometime you will walk in somewhere and be like, oh, check out that sign, that's what that weird lady was talking about. And you will be one with me. So any questions on that?
We do have one at school.
Awesome.
They walk in, it's right above the office. So.
That's your homework. Get excited when you see the sign.
I know.
Really cool. So there's a bunch of you guys here. All we're going to have you do is practice adult CPR, and then you're done. So I'm going to have my partner in crime over there, Josh. I didn't bring